Does that work?
Perfect. Yes, perfect.
Okay. All right. Okay. Okay. So just a quick overview what we're going to talk about, kind of get a perspective from what the rotations are, what we things kind of do, what type of rotations we have, and just perks of our program. You'll see a lot of picture of our residents hanging around, that all of them are before COVID, so no masks on those, just disclaimer there. All right, so as a program, we're very diverse. We have a lot of backgrounds, interests, but we can get along very well. We hang out all the time. This is a picture from us, from one of my faculty, Dr. Pham. She owns a house kind of up in the snowboarding area. So we go up there for a retreat every year. So some of us from California, some of us are not, and some are married, some are almost married, some are not married, single, have kids, dogs, cats. You know, some of us work out, some of us never work out like me. So we're all over the spectrum, and we love to see people just have a ton of different hobbies. And we also have very approachable faculty as well. You kind of see just dressing up together for research day. And then the picture on the right is from one of our graduations, kind of themed around celebratory things. So one of our attendings were dressed up in her wedding gown. So very fun faculty. So we're going to just go over the different rotations that we have. Our main campus is at the West LA VA. At there, we do have the ARU, the acute rehab unit. So you see a lot of bread and butter exposure to ortho, neurosurgical care. We also a center of excellence for stroke rehab. So you see a lot of patients for that. And occasionally we do have those zebra cases. Our VA veteran population has a lot of interesting medical comorbidities. And again, our attendings are very, very approachable. They're always happy to answer any questions you have. And call, we'll talk a little bit later, but for ARU, it is all home call. So you do 6-week blocks of ARU at a time, and of those, you do call about an average 2.5 weeks, and they're all home calls. At the West LA VA, we also do have the general clinic and pain clinic. So you do a lot of kind of musculoskeletal clinics, EMG, nerve conduction studies, and you do a lot of procedures there. We get over 300 procedures by the time you graduate, including Botox, ultrasound guided joint injections. You also do neuroaxial injections under fluoral during your senior years, trigger points, kind of anything that you can do in the clinic, we do. There's also the consults for general ARU consults and cardiopulmonary consults, just an inpatient consult service. It's run by us, PM&R, and we control who goes to the ARU and who gets cardiopulmonary rehab. So it's kind of a good thing that we get to evaluate these patients that we admit, to our own units. And when you're on consult, you do take 1 week of home call for the ARU units during the 6-week block so that the ARU residents don't get overwhelmed with their call. We also go to the Sepulveda VA clinic. It's more of an ambulatory clinic where you see a lot more, less complicated, but just higher volume of MSK injections, and again, EMG and CS. As a senior, you do go to the UCLA spine clinic to do more of the fluoroscopy procedures. And this year, Ronald Reagan was rated as a #3 hospital. So we get to go experience a lot of kind of patients there through clinic and procedures. Another inpatient rotation we have is the California Rehab Institute. It is the largest inpatient area on the West Coast, and it's a very new ARU unit, so it's very pretty inside. You do see a lot of young attendings there, which is really great because you kind of get to relate to them and ask them about their careers too. For this one, you see a lot more efficient, fast-paced rehab for patients who are more in the community, coming from like UCLA, Cedars, and just around the West LA, Los Angeles area. And on this rotation, you do take call, but it's kind of 7 a.m. to 7 p.m. 1 week at a time. So you don't do overnight call when you're on this rotation. You're located right next to a mall. So during lunch, sometimes people go walk over there, grab some lunch and come back. And you do see some VIPs there too. Rancho Los Amigos is one of our very much beloved rotations for traumatic brain injury, polytrauma patients. It's kind of where you see neuro rehab. So it is kind of very much known that everyone heard about the Rancho scale, and then also Jacqueline Perry is a master of gait. You do a ton of Botox injections there for spasticity, And you get a lot of perks. There's free food at the cafeteria for breakfast and lunch, and it's a very beautiful facility with a county population. So again, that's another totally different set of patients that you will see. CHLA is another one that you go as well with the PGY 4th year. You get a comprehensive pediatric rehab experience for TBI, spinal cord, ortho, and of course, zebra cases. CHLA is one of the top 5 pediatric hospitals out there. And Dr. Craig, our attending, is one of the leaders in peds rehab. So you get to learn just a ton of things from both of our patients and also our attendings there. And lastly, Long Beach VA. It's where we get our spinal cord experience. It's one of the largest dedicated spinal cord injury units. And everyone there is just kind of very versed in how to treat spinal cord injury patients. So you get a lot of experience through didactics and the patients. And you get to really experience what it feels like to be kind of a spinal cord patient. You can kind of try adaptive sports. You get to sit in on tendon transfer surgery, and you can try out hand cycling. And we also get to spend days in the wheelchair, both power and manual wheelchair, to get a feel of what it's like. All right, and let me hand it off to Dr. Hamadi.
Hey guys, I'm David, another one of the PGY 4s. So a little bit about the call schedule. Mia went over this a little bit already. So in our ARU, when we're doing inpatient rehab at the VA, so we have 5 to 6 weeks of call over 3 months, and that's home call. And we have the same kind of call when we're on consults, but that's 2 weeks out of 12 weeks. But then our other calls that we have are not home calls. On our peds rehab, we just have to go in for 4 total weekend days on the rotation, and you just go for a couple hours and round. And then at California rehab, we take calls 7 a.m. to 7 p.m. So also not a home call, and that's for 6 weeks out of 4.5 months there. And so in our program, because we see so many different things and work in a bunch of different settings, we feel pretty comfortable managing ARU patients at the acute level, mostly at Cal Rehab and at the VA as well. We have spinal cord injury and TBI patients at Rancho and Long Beach. We do a lot of injections, like Mia mentioned, in our clinics at the West LA and Sepulveda VAs. And right away we get into EMGs. Like first week, we like jump right into doing that. And yeah, so we work in a ton of different settings: county, VA, academic, private, and we also get used to using a lot of different EMRs. So just a feel for what our residents do after graduating. So the last couple of years, so in 2019, a few went into pain. One went into the unaccredited spine fellowship at UCLA. One went into sports, one went to neuromuscular, and 2 went straight into working, one at Loma Linda and one at RVA. And the following year, similarly, a few did pain, unaccredited spine fellowship again, another sports fellowship, SCI fellowship at Long Beach, and then 3 went straight into working after residency as well. And so we have a pretty big class, 8 to 9 residents per year, and we've been a residency program for a long time. So we have a pretty extensive alumni network in Southern California as well as across the country, which is great for jobs, great for fellowships. We try to have as many annual gatherings as we can, but obviously it's been difficult in the last year. But there's a pretty big network of alumni. And Dr. Aragaki, our program director, she's amazing. She's always there for us. She's probably the most helpful person I've ever met. And yeah, this is true. I'm applying to pain fellowship right now, and all my interviews, everyone says to say hi to Dr. Aragaki. So she's great. Can't say enough about her. Things that may change. So our VA uses CPRS, as they all do. They've been saying for a few years that they're going to change to Cerner, a different EMR. That hasn't happened yet. I think there are a lot of glitches that are happening, which is kind of expected when you're trying to change such a big system. But I think that should change soon. We do have a lot of different sites all across LA. And if people have been to LA, know there's a lot of traffic. It's a huge city. Luckily, most of our sites we're going against traffic both ways, so we don't run into too much traffic. But yeah, especially in third year, there are a lot of times you're going to be driving. And then doing research at the VA is kind of difficult too, as far as all the paperwork we have to do and jumping through hoops and things like that. But you live in LA if you do come here. So the weather's always great. There are a million things to do. You can always go to the beach. Yeah, LA is a great place. Yeah, and we mentioned Big Bear. So a couple hours away from LA, you can go. We do a couple of trips here a year, and Mia mentioned that Dr. Pham has a house there. And so we do our ski and snowboarding trip there for a couple nights. It's always a great time. As far as where our residents live, so most of us live in West LA, kind of around the West LA VA. Some people live in the Valley, a little bit more east in Beverly Hills and south Marina Del Rey. It is LA, so price of rent is pretty high. But through UCLA, we get a housing stipend of $1,000 a month, which is pretty great. And there's also UCLA subsidized housing pretty close to campus. But you don't get the housing stipend if you do the UCLA subsidized housing. So other perks of the program. So we have educational dinners about once a month where we go to a restaurant and get really good lectures. We have didactics every morning and also Tuesday afternoons. And we have a lot of opportunities to teach UCLA medical students. We kind of run their MSK block and teach them physical exam and a lot of MSK anatomy. So those are great teaching opportunities. So fellowship ties that we have in our program. So we have one of the few PM&R pain programs within our program, and we work with them all the time and throughout our clinics in our pain clinic. And there's also the Harbor UCLA Sports Medicine Fellowship. We work with them closely when we do Team to Win, which is like one of our volunteering opportunities. We do sideline coverage there for different high schools in LA. And so that's a good opportunity to work with people in that program. And then we also rotate at Long Beach VA where we do our SCI rotation. We're there for 3 months and we work very closely with the fellowship program director at Long Beach. Research opportunities that we have. So we kind of do research throughout residency. Right when we start, we try to join a research project. And then we get dedicated time for research as well. And then you can also use your month of elective that we get to work on a lot of research. And if you get things approved and submitted to APM&R, you may be able to go as a junior resident, and but we all attend as senior residents, or at least we try to, COVID permitting. And other things that we do as far as volunteering and teaching. So there's a mobile clinic we can go to. We do PBL, physical exam skills with the UCLA medical students, as well as MSK ultrasound. Dr. Pham, who's our associate program director and also the pain program director. She's the block chair for UCLA's MSK block. And we also get to teach medical students outside of UCLA as well. When we work at these different rotations, we have medical students who work with us as well, and that's always fun. And so UCLA has gyms on the undergrad campus and also on the grad school side, closer to the med school and dental school and the hospital. So you get, with $20 a month, you get access to really good gyms in that area, basketball courts, pools, volleyball, all kinds of different things. And our healthcare is pretty good too. We have very good benefits through UCLA. It includes dental and vision, co-pays, family coverage. And like we mentioned, UCLA is the #3 hospital. So great medical care. And when you mention that your house staff, they take very good care of you. They try to prioritize your care, which is great. And a little bit more about the didactics that we go through. So Dr. Miller is the anatomy professor at UCLA. And when we start our residency, we go through a very good MSK anatomy series with Dr. Miller. And we do this every year and kind of just build upon what we learned. And it's a great refresher every year as well. Also at the start, while starting EMGs, we also have didactics and the lecture series running side by side with that. And then later on in the year, we go through a bunch of different fields of rehab as well, orthotics, bracing, prosthetics, a lot of different topics we go through throughout the year. And these are just kind of pictures of what we like to do outside of work, restaurants, bars, birthdays, all that fun stuff. Went to a Laker game. So do you guys have any questions for us?
Just a heads up, you got 2 minutes left.
Ooh, okay. Okay, I'll start with, who was the first question from? Prague, regarding, okay. So UCL, if we accept, I'm not sure, Mia, do you know that? Regarding,
I can't find the first question. Where is it?
Can
you read the question?
Yeah, I was wondering if UCLA via PM&R accepts ECFMG sponsored visas and Canadian IMGs.
Yeah, I don't know the answer to that one. Yeah. We're part of the ACGME, so it kind of just goes with their policy, whatever their policy is.
But email us, and if we can't get to these questions, email us and we'll get to all the questions. So sorry if we can't get to everything right now.
Where do you think UCLA can improve in regards to its PM&R program? So I know that our sports med program wasn't very strong in the past. We didn't have that much exposure to it, even though we have the West Coast volunteer activities. We recently did hire a sports med physician attending who's really good with ultrasound. So he's been trying to teach the residents a lot more how to use the ultrasound and how to do kind of the more injections with it. So that's something that we're working on. Where do most of your residents do their prelim year? A lot of them kind of end up in the California area just because the region, but they go all over New York, North Dakota, all the place. We don't have any that specifically feeds into UCLA, which is like a separate prelim, whichever prelim you end up at. What sorts of resident retreats have you done? We usually go to the Big Bear every year, so that's one thing. Sometimes the girls go to Vegas together. That's another thing. Do residents have access to UCLA golf course? I don't know. I never really tried. Yeah. Probably because we're UCLA residents technically. So. Any opportunity for sports? Okay.
I'm gonna have to cut you guys, but you're more than welcome to stay on and answer the rest of the programs in the chat, or just redirect them to your email. I know you shared your contact information with me. And I'll be updating that and sharing that with our attendees tonight and with the rest of the people that signed up for the residency fair that couldn't be here. But I thank you from UCLA for coming. It was a great presentation.